Enjoying a glass of wine or a cocktail can be a great way to unwind. But did you know that alcohol can interact dangerously with certain medications? Many people don't realize that mixing alcohol with some drugs can lead to serious side effects like dizziness, drowsiness, liver damage, or even life threatening reactions. Whether you take medications for pain, allergies, or mental health conditions, it's essential to know which ones should never be combined with alcohol. Here's a breakdown of 10 common medications that you should avoid mixing with alcohol and why. Number 1. Pain relievers: acetaminophen, ibuprofen, and naproxen. If you take acetaminophen for a headache or fever, avoid alcohol at all costs. When combined, the two put excessive strain on the liver, increasing the risk of liver damage or even failure over time. NSAIDs like ibuprofen and naproxen don't affect the liver as much, but they can irritate the stomach lining, leading to ulcers and internal bleeding when mixed with alcohol. Even though these medications are available over the counter, they should never be underestimated. If you need pain relief, it's best to wait until the alcohol is out of your system. Number 2. Sleeping pills: zolpidem, azopiclone, and others. Many people take sleep aids like zolpidem, Ambien, or azopiclone, Lunesta to get a good night's rest. But combining them with alcohol is a dangerous mix. Both alcohol and sleeping pills are sedatives, which means they slow down your brain and nervous system. When taken together, they can cause extreme drowsiness, confusion, dizziness, and even unconsciousness. In severe cases, this combination can slow down breathing and heart rate, leading to a medical emergency. If you rely on sleep aids, avoid alcohol completely. Number 3. Antidepressants: fluoxetine, sertraline, and others. Many people take antidepressants like fluoxetine, Prozac, sertraline, Zoloft, or venlafaxine, Effexor to manage depression and anxiety. However, drinking alcohol while on these medications can make side effects worse. Alcohol is a depressant, meaning it can reduce the effectiveness of these drugs and make symptoms of depression and anxiety more severe. It can also cause increased drowsiness, dizziness, and poor coordination, which raises the risk of accidents. For those on antidepressants, avoiding alcohol can help the medication work more effectively while preventing unwanted side effects. Number 4. Anti-anxiety medications: benzodiazepines like Xanax and Valium. Medications like alprazolam, Xanax, diazepam, Valium, and lorazepam, Ativan, are commonly prescribed for anxiety and panic disorders. These drugs are already sedating on their own, so adding alcohol to the mix can be extremely risky. Combining alcohol with benzodiazepines magnifies drowsiness and impairs judgment, which can lead to dangerous falls, blackouts, and slowed breathing. In severe cases, this interaction can be life-threatening, especially if taken in high doses. If you take anti-anxiety medication, it's safest to skip alcohol altogether. Number 5. Antibiotics: metronidazole, linezolid, and others. If you're on antibiotics like metronidazole, Flagyl, or linezolid, Zyvox, drinking alcohol can make you feel extremely sick. These drugs cause a reaction similar to antibutyl disulfiram, a medication used to treat alcoholism. Mixing alcohol with these antibiotics can lead to severe nausea and vomiting, flushing, red, hot skin, rapid heartbeat, dizziness, and headache. Even other antibiotics like doxycycline or amoxicillin don't react as dramatically but can still weaken your immune system, making it harder to fight infections. When taking antibiotics, it's best to hold off on alcohol until you've finished the course. We made a book, 10 questions everyone should ask their pharmacist. You can find a link in the description below. Feel free to check it out. Number 6. Blood thinners, warfarin, apixaban, and others. If you take a blood thinner like warfarin, Coumadin, or apixaban, Eliquis, to prevent blood clots, you should be extremely careful with alcohol. Alcohol affects how blood clots, and when combined with blood thinners, it can increase the risk of internal bleeding and bruising. Drinking heavily can also make the medication less effective, increasing the risk of strokes or heart attacks. If you're on blood thinners, talk to your doctor about how much alcohol, if any, is safe for you. Number 7. Diabetes medications: insulin and metformin. For people with diabetes, alcohol can cause dangerous blood sugar swings, when mixed with medications like insulin or metformin. Alcohol lowers blood sugar, and when combined with insulin, it can lead to hypoglycemia, dangerously low blood sugar, causing symptoms like dizziness, confusion, and even unconsciousness. Meanwhile, metformin, glucophage, can interact with alcohol and increase the risk of lactic acidosis, a rare but serious condition that can cause muscle pain, weakness, and difficulty breathing. Diabetes management is all about balance, so if you drink, do so carefully and monitor your blood sugar closely. Number 8. Cough and cold medications, dextromethorphan and antihistamines. Many over-the-counter cough and cold medicines contain dextromethorphan, DXM, antihistamines, or pseudoephedrine. These ingredients can have strong sedative effects, which alcohol can make even worse. Mixing alcohol with cough medicine can cause extreme drowsiness, dizziness, and poor coordination, increased heart rate, and high blood pressure. If you need to take cold medicine, it's best to skip the alcohol until you're feeling better. Number 9. ADHD medications, Adderall, Ritalin, and others. Medications for ADHD, such as amphetamine-based drugs like Adderall or methylphenidate, Ritalin, are stimulants. Mixing them with alcohol can have dangerous effects. Stimulants make people feel more awake and alert, which can lead to drinking more alcohol than intended without realizing how intoxicated they actually are. This increases the risk of alcohol poisoning, dehydration, and heart problems. If you take ADHD medication, be mindful of how alcohol affects you and drink cautiously or avoid it altogether. Number 10. Heart medications, beta blockers, and ACE inhibitors. Heart medications like beta blockers, propranolol, metoprolol, and ACE inhibitors, lisinopril, enalapril, help lower blood pressure. However, alcohol can interfere with these drugs, making them less effective or causing dangerous blood pressure drops. Low blood pressure can lead to dizziness and fainting, weakness and fatigue, and risk of falls and injuries. If you're taking heart medication, it's important to limit alcohol intake and monitor how your body reacts. While alcohol is enjoyable in moderation, it's crucial to be aware of how it interacts with medications. Some combinations can lead to serious health risks, so always check with your doctor or pharmacist before drinking. When in doubt, it's better to skip alcohol than risk dangerous side effects. Your health comes first, and a little caution can help you stay safe while enjoying life responsibly. Hey, I'm Dr. V and welcome to my channel. Please check more of my videos about health and medications, and cheers to a healthy life.